Hello, I'm Tracy Finch. I'm really pleased to be presenting to you today on behalf of the ImpleMentAll Consortium at the UK Implementation Science Society's fourth conference. And I'm going to share with you some of the findings from our process evaluation of the ItFits-toolkit from the ImpleMentAll study.
So we have good evidence already that internet-based interventions for mental health are effective, but implementation and scale-up continues to be a problem. The ImpleMentAll study was conducted over 51 months and involved 16 partners from 11 countries, mostly Europe and including Australia. We firstly developed a toolkit based on tailoring of implementation, and then we evaluated the toolkit in a randomized cluster step wedge effectiveness trial, where the outcomes of interest were implementation outcomes, which included NOMAD as a measure of implementation based on normalization process theory, and other outcomes such as uptake and referral. So the ItFits-toolkit that we developed is a step-by-step process that guides implementers through 4 stages, starting with identifying the problem, tailoring solutions, planning and undertaking action to address those, and finally monitoring and evaluating those strategies. Throughout the toolkit, we've used evidence-informed materials. We've also developed some general principles to guide implementers in working with the toolkit. And we would describe it really as just a systematic way to work with a team and with stakeholders to address implementation problems. So the online toolkit itself also has various tools for collecting and storing information, and we put a lot of time and effort into ensuring the design of it was user-friendly. And this slide here just shows you the structure and the inputs to the toolkit across the 4 different modules. And what's really key here is that in each module we embedded a process of stakeholder engagement, which acts as a cycle that involves initiating some ideas, going and talking to stakeholders to verify if those are correct, discussing them, and then finalizing how to move forward to the next step. The process evaluation of the toolkit was primarily qualitative, and we were interested to understand how the toolkit worked in practice and what mechanisms shaped that work. So our questions were, how do the implementation teams engage with the toolkit? How is the toolkit reconfigured and adapted within and across the different settings in the project? And what factors shape the implementation of the toolkit? The process evaluation commenced once the first implementation sites crossed over to the active phase of the trial, and we had 2 sites coming on every 3 months in the step wedge design. So our study included 13 sites, which included 12 that were in the effectiveness trial plus an additional site that just took part for the toolkit only. And we asked sites to spend a 6-month period working with the toolkit while they were in the active phase of the trial. So we conducted 55 interviews altogether, and this represented 30 different interviewees. So the interviewees were implementation leads, core team members who were not necessarily the leads, but members of the team, and other stakeholders as appropriate. And we undertook multiple interviews over time, and conducted 2 to 7 interviews per site. We also undertook observations, and these related to things like training events, support calls, and on these support calls, which happened every month during the active phase of the trial, we may have had up to 4 different sites taking part together in a guidance meeting. So we observed all of those as part of our data set. Data analysis for our project was really interesting and a lot of fun, very complex at times given the number of sites involved and the different countries, but we took a very collaborative approach to this across different work packages in the project. So there were quite a lot of members of the research team working on this and sharing their interpretations of the data. It was a very iterative approach, so we were coding data, discussing, developing ideas, using that to inform further field work. And we did a lot of conceptual work with the data, So drawing up models, testing out ideas, case studies, etc. The online toolkit itself gave us quite a lot of data about the activity of the implementation teams and the work that they undertook. And what we see was that 31 projects were initiated across the duration of the study, and quite a lot of those projects completed to Module 4, and a higher number completed to the end of Module 3, so they got to the point of implementing their strategies, although some didn't necessarily complete the full 4 modules. The common barrier areas that these projects address were around acceptance, working processes and engagement, and the strategies that they drew on fell mostly in the categories of education, planning, and quality management. So the first thing we see in our qualitative results is that implementers found the toolkit to be slowing down their work and stopping them from moving too quickly. So I think this was a bit unexpected, but in working in this way, they came to see the value of a structured and slowed down approach. And here one of our implementers describes having found that gave them much more contact with their stakeholders, and it allowed to plan things so that they worked better. We also found that in using the toolkit, implementation teams were able to reframe their relationship to implementation work. And a key element of this was the coordinating structure of the toolkit. And here one of our implementers describes how the toolkit really ensured that they had a clear plan and a trajectory going forward with their work. And there's a sense here that having this structure and this process may have avoided going down unfruitful directions, or as they refer to it here, less random tangents. We observed that the ItFits-toolkit required the sites to continually negotiate compromise. So that means aligning and realigning the desires, interests, and priorities of all the different stakeholders that were involved in the implementation projects in order for them to progress. So we saw this mostly in relation to the stakeholder work, but we also saw, and perhaps not surprisingly, the ways in which implementation teams had to negotiate a whole lot of external and internal issues and events that had the potential to either stop their projects altogether or severely delay those projects. And these were some of the typical things that happen in organizations that include staff turnover, changes of strategies, policies, absences. But in particular in this study, we were plagued with a number of natural disasters, including bushfires, earthquakes, and of course COVID-19. And what we observed in the study was the way in which teams had to kind of work around those issues in order to keep things progressing. And another important thing to note about factors affecting the work undertaken with the toolkit is that this although we were studying this in a real service delivery setting, we were also studying it in the context of a trial. And that trial provided a certain kind of structure and timelines as a backdrop to the work that was being undertaken. And the teams were certainly benefiting from that in some ways in terms of resource and support, but also it may have affected some of the decisions about projects in terms of timelines and assessments about what was feasible within those timelines. And the final results slide I'll share with you tells us a little bit about what our implementation teams may have taken away from using the toolkit. And users differentiated between the online digital platform in all its detail and content and the learning that they gained from using the toolkit that they may then apply in future projects. So although, and certainly some sites did say they would continue to use the project and they were free to keep using it as long as they wanted. Others said that they may just take away the principles and some of what they learned rather than using the full toolkit itself. But there were some quite positive reflections about how the toolkit could be useful in work going forward outside of the trial. And to very quickly summarize the results, we found that the teams introduced the toolkit by making sense of it and seeing the value of it for their work. In relation to embedding, the toolkit developed, adapted, and coordinated the implementation work the teams were doing. And a central part of this was the continuous processes of stakeholder engagement that they undertook. And certainly embedding the toolkit was affected by a number of factors that I've just described. And we saw some indication of ways in which the toolkit might be sustained in terms of reframing some of the routines of work. So in closing, toolkit users found it workable, and they could see opportunities for different ways of working with ItFits, either in a formal or a more informal and flexible way, depending on the needs of their work and their organizations. But it did change the way that implementation teams worked in the study. Now, the trial result itself was that the toolkit had a significant but modest positive effect on the implementation outcome, which was the NOMAD survey. This needs to be explored in quite a lot more depth, but what we would say is that the execution of the actual strategies that the teams implemented and undertook was affected by a range of factors, and we would need to understand a bit more about those strategies themselves, and the trial wasn't powered to explore the relative effectiveness of different specific strategies. So our focus was very much on the toolkit. So I leave you with that point, and thank you very much for listening.